This is the moment of opportunity. It is also the moment of maximum risk, because I know there will be many people looking now at our apparent success and beginning to wonder whether now is the time to go easy on those social distancing measures.
Under pressure from some to relax lockdown for the economy's sake, but resisting for now.
And so, yes, I entirely share your urgency. It's the government's urgency. And yet we must also recognise the risk of a second spike, because that would mean not only a new wave of death and disease, but also an economic disaster. I refuse to throw away all the effort and the sacrifice of the British people, and I ask you to contain your impatience, because I believe we are coming now to the end of the first phase of this conflict.
The second phase will require grit too.
If we can show the same spirit of unity and determination as we have all shown in the past 6 weeks, then I have absolutely no doubt that we will beat it together. We will come through this all the faster, and the United Kingdom will emerge stronger than ever before.
The Prime Minister's return to work is undoubtedly a moment of success in this grim coronavirus crisis. He has survived, but sadly tens of thousands have not. We are passing through the peak, and everyone now is counting the cost, some much more than others. Everyone wants to move on, but the Prime Minister marked his return to work by managing those lockdown expectations. The government knows it needs to keep the public with them. This, a new initiative at the Daily News Conference.
We'll take our first questions from a member of the public. This is going to become a regular feature of these briefings. The questions are selected by an independent polling organisation. And now we're going to go to the first question, which is from Lynn in Skipton. And I'm going to read out the question, and I'm reading it for the first time, and then we will endeavour to answer it. I'm missing my grandchildren so much. Please, can you let me know if after the 5 criteria are met, is being able to hug our closest family one of the first steps out of lockdown?
We all know how hard this is. My own mother lives hundreds of miles away, and I know she's wondering when she'll be seeing me and her grandchildren again. This is really tough, but as the Secretary of State has said, it is bearing fruit in that we are seeing reduction in the number of hospital admissions, we're seeing a reduction in the number of deaths.
And other very difficult questions too, such as why the UK death rate has far exceeded initial expectations.
The number will definitely exceed 20,000. We need to view this epidemic over the long run, and this has got a very long way to run. I'm really cautious about putting out, and I've said this again repeatedly, these kind of absolute numbers, because this could go in a lot of different ways over the next many months until such time as we have a clear exit.
Into our 6th week of lockdown, normal life feels a world away, and the PM guarded today about what comes next. But he knows he'll have to give the public more in the coming days. And he knows too, there are no easy answers. Beth Rigby, Sky News, Westminster.
Well, as the number of deaths starts to level out and the longer restrictions are enforced, the government thinks there is a danger that people could become complacent. Traffic volumes, for instance, on Saturday were 5% higher than they were the week before. Well, Ashish Joshi has been analysing some of the latest data and joins me now, and take us through it then, Ashish.
The question people will be asking themselves at home is just how long will this lockdown remain in place? How long do I have to abide by the government's restrictions? When they hear language used by the Prime Minister of passing the peak, almost being through the worst of it, psychologically that can make people think that this is it. We're in the clear and we can resume our lives. But of course we know from the evidence, we know from the data, we know from the countries around the world that that simply isn't the case. Although all the numbers which we're looking at now reflect a downward trend, all of them except one which is going upwards, and that's good. That's the rate at which the number of deaths doubles. That's almost at 19 days now. But every other significant number is downward. Of course, it presents a tragedy for a family, still in the hundreds because it's going to take a while to come down from that very high peak. Let's have a look at what is actually happening in society. The first slide we're going to show you now is mobility. This graph shows mobility trends from Apple, and as you can see, quarantine fatigue is setting in slightly. People are starting to move around, with activity starting to increase. Traffic volumes on Saturday were 5% higher than the week before, and this is echoed by statistics from TomTom, showing congestion rates today in London at 14% compared with 13% a week ago. But it's the daily number of deaths reported and the people in hospital that the government will be watching closely. That's this slide here. The number of people dying in hospitals is reducing. Today, there were 360 deaths. That's the smallest total since March the 30th. The line of this chart, the one there, the brown line going from the bottom up towards the top, that's a rolling 7-day average, and it shows the growth in deaths is slowing and is no longer exponential. But that downward trend is slow, and the government will want numbers to be consistently much smaller before they consider easing restrictions. If we move on to the next one, and this is very important as well. Again, you look at the trajectories, all of those lines for all the different regions. The line, once it's reached that peak in the middle, the trajectory is downwards. That's the number of people in hospital beds, and it gives us a clue as to how prevalent the virus is in the community. Here too, there are positive signs, with the numbers down in England 16% in the last week alone. But some epidemiologists believe these numbers need to go down much further. Let's look at the last slide. This is the other key indicator, and this is the percentage of people who test positive for COVID-19. Today, that figure was 4,310. That's around 17%. It's been as high right at the start of the pandemic, as high as 40%, but experts say it still needs to come down much lower to single figures. Now, the reason for that is we've heard the Prime Minister and his scientific advisor say there is a real danger of a second wave, a second peak. And that means all the sacrifices people have been making for the last 5 or 6 weeks will simply be undone. This is a virus we still don't know very much about, even though we're 6 weeks into a lockdown and 3 or 4 months after the first cases were reported.
Ashish, many thanks. Ashish Joshi there with the analysis. Well, plenty more on the pandemic again in tomorrow's papers. We're taking a first look at the front pages in the press preview at 10:30 with the editor of the Times literary supplement, Stig Abel, and the journalist and author, Jenny Kleeman. Well, now, the UK's effort to protect people from COVID-19 is accelerating. Human trials of a vaccine are now underway, and the scientists carrying them out at Oxford University are talking about producing about 1 million doses by September. But the Department of Health's former head of immunisation, Professor Salisbury, says the government has to be completely transparent about the advice that it's receiving. He was speaking to Sky Science correspondent Thomas Moore. He has this report on the calls for transparency.
A decade ago, Professor David Salisbury was at the heart of the government's response to the swine flu pandemic. Now on the outside, he's frustrated he can't properly judge the lockdown on COVID-19 because the key strategic committee operates in secrecy.
Why should we not know? Why would we want to have such secrecy that you can't know who is helping shape these decisions that are affecting our lives so intrusively?
The government's chief scientist insists the committee, the Scientific Advisory Group for Emergencies, has nothing to hide. Its makeup and the minutes will be published shortly, and he says there's nothing sinister about the Prime Minister's advisor, Dominic Cummings, sitting in on the discussions. That depends, says Professor Salisbury.
If the chair has allowed a person who is not a member of the committee to take part, then the chair has to address how that information is handled at the committee, and then has to be prepared to answer afterwards what influence that intervention from a person who was not a member of the committee had on the process.
Several vaccines around the world are now in trials, but Professor Salisbury cautions that there are no guarantees. Even if they do work, with lives and economies at stake, there may be export bans from some countries.
We will have to worry about equity and about access to vaccine and nationalistic behaviour. I think that it's very difficult for any national leader to take the totally equitable position and say we are only the same as everybody else and therefore whatever we produce will be shared.
Much of the world was caught by surprise by the coronavirus. Professor Salisbury says judgment on how well the UK coped will have to wait until the pandemic is over. Thomas Moore, Sky News in Oxfordshire.
And just to let you know, you can watch a full version of that interview with Professor Salisbury. We're broadcasting that in about 20 minutes' time, 7:30. Now, the number of people who have died in hospitals and care homes is announced every day, but it's important, of course, to remember that behind every number, every statistic is an individual who leaves behind family and friends. Well, among the victims of COVID-19 is Gerald Davis, paramedic at Coombala Station in Swansea, who had been awarded an MBE for his services to first aid provision in Wales. He was the first member of the Welsh Ambulance Service to die from COVID-19 a week ago today. His colleagues described his death as a devastating blow. Sue Baskind from Leeds was described as a very active, very fit, very hospitable, welcoming, beautiful lady by her son, Dr. Robert Baskind. Sue had 3 other sons and 11 grandchildren. She died at the age of 74 and is understood to have had underlying health conditions. Amor Padilla Gatinao worked as a nurse at St Charles Hospital in West London. Originally from the Philippines, Amor had worked for the NHS for 18 years. She's survived by her husband Mario and their 3 children. Now, many hospitals have had to adapt radically to deal with the COVID-19 pandemic, keeping those who have been infected with coronavirus separate from non-coronavirus patients. Well, Sky News has been given special access to Warrington Hospital, which is going to great lengths to try to protect its patients and staff. And our special correspondent, Alex Crawford, has this report from Warrington Hospital, coping with COVID-19.
Good morning.
Hello. Just ringing to see how's the patient in Resus 4.
There are 2 types of patients now at Warrington Hospital, COVID and non-COVID.
Okay. So his obs are all right and everything, he's fit to go up to the ward, is he?
And they go to strenuous lengths to ensure they don't mix. The emergency department is now in 2 halves, and this is a red zone, where the latest arrival is a man with coronavirus symptoms. The hospital's COVID cops are called. They're security guards used to patrolling the grounds, now trusted with keeping patients safe and the virus at bay. They close corridors and seal doorways
Got the call signs, on the move.
to secure a route to take the patient up to a coronavirus ward as quickly as possible.
I love this. Love getting involved and helping out. It's a pleasure to do this for the NHS. So, yeah.
How do your family feel about you doing it?
They're very proud of me. So I've got little children, so they're loving it.
Oh, so I'm just going to see where this is.
The trauma teams are coping with the like of which they've never seen before.
Emergency adult trauma team, please go to A&E Majors 2.
This is a simulation. They're training on the job in the middle of a pandemic.
Are you good to go?
It's crucial they work out how to stay ahead of this deadly virus that few in the world know much about.
Okay, so we'll go on 3. 1, 2, 3.
This is coping with emergencies in the time of coronavirus. Everyone could be a potential COVID patient. And not long into this training session, the team realise the life-saving treatment they have to do means they're putting themselves in danger.
Guys, you can't tube. You've not got your FFP3 on. We don't know anything about this patient. Yeah, but what about the rest of us?
So I think this is an aerosol generating procedure.
Most of them aren't wearing enough personal protective equipment, so they have to leave the simulated emergency to kit up. Many are from different departments, working together for the first time, and there are constant tough choices.
We don't want to use up all the personal protective equipment that we have, but we've got to keep our staff safe, and it's just finding the right time to put the right kit on. That's good tube, you've got good CO2 on that, and that's a successful intubation. We're going to change the mannequin now.
So this is only a simulation, but you can see how their work has changed entirely and how they're having to learn different techniques and how to adapt to the COVID-19 era.
They need to keep thinking of new tactics to tackle this virus.
Hello, Alex.
Oh my goodness, you look so different.
Yeah, do you think?
Yes.
Donna's like a woman reborn since we last met. Look how she was just days earlier.
I don't want to be a statistic in this.
Now she's living every second and loving every minute.
And I'm feeling so much better. I'm so much happier. You know, I'm getting there. And my smell's coming back, my taste is coming back.
She didn't think she'd make it.
I was so scared. I just thought I might die. But I'm not going to cry because they've looked after me so well and they've really done their best. Nothing's been too much trouble. They've explained everything to me and I'm just thankful to each and every one of them.
She's desperate to get back to her 2 young sons. Then, whilst we're still with her, she's told she's leaving ICU.
That's such good news.
Yeah. We'll have to get you there now because we're expecting more people. You've done extremely well though, haven't you? You'll be fine on the ward, won't you? Absolutely fine. So I'm going to ring security now to lead the way. OK.
How do you feel about that, Donna?
Well, I didn't expect that.
That's amazing news.
Yeah, I didn't know.
It's all stations go now, but still time to say thank you to the people she believes kept her alive.
Thank you. Thanks for everything. Thanks for looking after me.
The bond between carer and those who've come so close to death is a shared one, as is the sheer joy at finally being able to say goodbye. Alex Crawford, Sky News in Warrington Hospital.
And this is Sky News Tonight. Coming up, why Iceland is perhaps the perfect country to study COVID-19.